Hello, everyone. My name is Dr. Ben Thompson, and we are live here on YouTube and Facebook to talk about tinnitus and hearing, of course, our favorite subjects. I'm an audiologist, and today I want to introduce Michelle Neidleman Kennedy, Doctor of Audiology, into the Pure Tinnitus family. Dr. Michelle, please tell us a little bit about yourself.
Hi, so nice. Thank you for having me on. I'm really excited to be part of the Pure Tinnitus team. And a little bit about me, I am located on the East Coast. I live outside of New Jersey. I've worked in New York City and in North Jersey for all of my audiology career. Most of my career has been at NYU Langone Medical Center in the city, and most recently at Hackensack University Medical Center in New Jersey. I've also had the opportunity to work as an adjunct, which has been wonderful, teaching other audiology programs, both undergraduate and at the graduate levels. And, I'm really happy to be able to be part of the team working here, providing support for individuals from all over the world that are having, issues with tinnitus as well as their hearing loss, because helping others is really the ultimate reason why I came into the field of audiology. And it's been amazing to be able to be at the forefront, being able to help people that aren't just the ones physically coming into our offices.
Amazing. So we care about better hearing and we try to have less tinnitus with our patients. So better hearing, less tinnitus, sort of our motto here. Michelle, from your experience at NYU, New York University, one of the hubs, one of the mecca of audiology in the New York area, what were your major memories there? I'm sure you had a lot of experiences with patients, complex cases. What are some memories that come to mind?
I mean, when I think about my time there, I definitely think specifically of certain patients that I've had that, surprised me with their life experiences, shared, included me in part of their journeys, both in terms of their hearing or tinnitus issues, as well as just like life, retirement, children, families, being at the forefront of new treatments and procedures for both hearing impairment, tinnitus. Being able to work alongside a multidisciplinary team has also been an amazing, such an amazing attribute and experience of mine from NYU. But, it's really about the people. It's just everyone has such a, everyone brings so much to every appointment or every consultation. And ultimately, I couldn't even think of just one because it's just overall having had the opportunity to touch the lives of everyone from newborns all the way up to senior citizens. And, it's something that's very rewarding and gratifying.
Amazing. And shout out to the 28 people who are here with us live. So we're going to spend the next 20 minutes or so answering live questions, some of the most commonly asked questions. Underneath the video here, you can check out a form where you can ask questions, which we will review. Also, if you want to put it in the comments, if you're on YouTube, you can put it straight into the comments and we'll answer those in just a moment. So Michelle, uh, is it possible to get better with tinnitus from what you've seen at NYU?
It definitely is. I mean, unfortunately, there's not one overall cure for everybody. Everybody's tinnitus is very different, and what may work for one person doesn't work for another. But the ultimate takeaway message is that there are tools and things that we can do to help with our tinnitus. And if you are willing to help your tinnitus, we are willing to help you, and we are willing to share, as many of the tools and tips and strategies that there are available for combating tinnitus. I think that the best thing to know is that it is an area of research and it's always been a hot topic, and there's constantly new developments coming in terms of technology that's available to help manage tinnitus, as well as all the different methods for trying to tackle tinnitus from a more counseling standpoint. I think that it's important to know that there is hope. And oftentimes the first thing people are told as soon as they mention that they have tinnitus is that there's nothing that can be done, but that's couldn't be farther from the truth.
Mhm. Love that. And before we get into these live questions, do you have any family members who have tinnitus or hearing loss?
I do. Actually, my father, he has hearing loss, and I was able to fit him with hearing aids a few years ago. And although he's not the most ideal, or he's not the most consistent hearing aid user, he is the first to admit that he hears so much better when he wears his hearing aids. And he does so much better when we're in group settings because of the hearing aids. And, his hearing loss is the typical grew up in the 70s, went to a lot of live
Mhm.
concerts and played in a band and had, a lot of loud hobbies. And now he's, in his early 70s. And so, it's amazing though that at least he really actually notices the difference
Yeah.
because he wasn't the most forthcoming with wanting to come and get his hearing tested or get hearing aids even after I was, a graduated audiologist.
And what do you guys typically do when you all gather? Is it indoors, family, with kids? Is it out at restaurants? How does his hearing really come into play?
So we have a big extended family, and obviously pre-COVID, we would be getting together more often than not. And so sometimes it would just be at home, but there'd be like, 20 of us between grandchildren, great nieces, great nephews, cousins, aunts and uncles. And so a lot of times, yeah, in more of those like large group settings. And then, yeah, when we were able to go out to eat, we were able to go out to eat, but in a safer way. We
Yeah,
would definitely go out to eat. And yeah, I mean, I'm one of three and I have two kids, and all my siblings have significant others. So just with us alone, it's already a big group of people.
that's a lot for me to
Yeah.
hear. There's a lot to hear there, a lot of conversations
Yes.
going on. Well, thanks for sharing some of that personal touch. I am going to now switch it into answering questions, right?
Mhm.
I'm going to show a nice graphic on the screen here. Is that we have two tinnitus doctors live, and we're going to answer some questions. So this is fun. For the next 20 minutes, we'll be answering questions. All right. And hello to Darren and Pamela and Paul and Jatish and Rashid who are in the comments. So good to see you all here. So let's start here with a question that we had about meditation that came in. A question that came in underneath the YouTube description. There's a form to fill out. Please fill out that form and we'll make sure to answer them on the upcoming live streams here. The first question we had is does meditation with tinnitus as the object assist habituation or not? Well, some back context to this is that it has been shown that meditation and mind body exercises that can calm the central nervous system of the body, also referred to as the autonomic nervous system, that can have an indirect positive change on the brain's filtering of tinnitus. So that can help assist habituation to meditate. Now, there's different meditation techniques, different styles, what to focus on. Most people focus on the breathing. And this question is asking, what about focusing on the tinnitus? There's a colleague who describes a tinnitus meditation technique of focusing on the tinnitus and noticing that the mind drifts off. And after some seconds, we're not thinking about tinnitus anymore because our minds can't concentrate for that long. I'm okay with using tinnitus as a meditation object, but usually for a short period of time to show the brain that, okay, sitting with tinnitus in a quiet place, facing it head on, it's not scary. It can be done. Um, Transitioning into other forms of meditation are typically better after that. All right. Next question here from the forum. I've had my tinnitus for 18 months with mild hearing loss. I'm doing all the right things to be relaxed and stress free, but my volume will not go lower than an 8 in both ears. Any suggestions? Michelle, I'll kick this to you. Just a refresher here. 18 months, a year and a half of tinnitus with mild hearing loss. They say that they're doing all the right things. Well, what might those right things be, Michelle?
So we definitely want to manage our stress, anxiety as much as we can because we know that tinnitus really works off and feeds off of our stress and anxiety levels. So if we take positive measures towards trying to manage our stress, anxiety, whether it be through meditation, breathing exercises, yoga, just actual physical exercise, maybe picking up a hobby that you might have, stopped doing a few months ago or a few years ago, or starting something new, can, by trying to reduce our stress and anxiety levels, it can have a positive impact in terms of how much we're perceiving our tinnitus. We also know that enriching our sound environments with other sounds, whether it be nature sounds, white noises, pink noise, music, having other sounds in the background of our daily life is very beneficial for those who have tinnitus. And there's different ways that you can actually include sound enrichment in your daily life. So obviously, you can wear headphones, but one of the downfalls of wearing headphones is that then you're kind of cutting yourself off from the environment around you. So if someone's calling to you from another room, you may not hear them. So there are things like bone conduction headphones that you wear on your head, and you're still able to hear the sounds. You have that background sound going, but you're still also accessing all the sounds around you. So sound therapy, both during the day and at night, has been very beneficial for managing tinnitus. Like I said, trying to improve our stress and anxiety levels, reducing them. If you do have hearing loss, sometimes managing the hearing loss, so looking into maybe getting hearing aids with sound generators can help with tinnitus. So those are some of the strategies, and obviously, changing our overall mindset and our thought process behind tinnitus, because sometimes while it starts off as being caused by the hearing loss, the true culprit is how our brain is perceiving that sound. So we start to attribute tinnitus as a dangerous sound, something negative, something that we should be worried about, preoccupied, and the brain feeds off of that. And then we start to kind of create this mental cycle of, when we hear the tinnitus, it is something that's negative in our lives, and then our body starts to experience all the same types of symptoms and side effects that we have when we are in periods of stress and anxiety. And so trying to change your outlook in terms of how you perceive your tinnitus can also ultimately maybe help how you are perceiving the tinnitus in the end.
Amazing. I want to bring a comment in here. So, as we're seeing on the screen right now, we have Pamela who says that they went to the ear doctor and the doctor told them that they have a small amount of hearing loss and that there was nothing they could do for tinnitus. Sorry, see ya. Is there a better way, Michelle? What's needed here? Is it education of doctors? Is it audiologists stepping in to bring this holistic perspective? How does that come together?
I think it's a combination of the two. Like, I think that a lot of physicians and audiologists might be trying to simplify it, because there really isn't just like a single cure. You can't get an antibiotic, a prescription, or, a vaccine that's going to take away your tinnitus. And so, they kind of like latch on to that, but rather than providing options and things that might be related to helping improve the tinnitus, or things that, and explaining what may have caused the tinnitus. I think a lot of the stress around tinnitus is that it just comes up one day, and we're worried that it might be something more serious in terms of our medical health and well being. When oftentimes after getting a full medical workup to ensure that there's not anything that's medically causing the tinnitus, oftentimes we find out it's just something that is more related to both the inner ear and how the brain are, communicating with one another and interpreting the sounds from within. And rather than, something more scary, as a lot of people are told that we have to rule out that you might have a tumor, or that maybe be something more medically involved around the tinnitus, or simply that there's nothing that can be done and you just have to learn to deal with it. And oftentimes you need to work with someone in terms of knowing what may cause tinnitus and what we can do for tinnitus in order to be able to get to a better place with our tinnitus. And so those are some of the steps that I feel like are missing from a lot of both physicians and audiologists when someone comes up and says, I have this tinnitus and it is bothering me, because most people do experience some degree of tinnitus, whether they're in quiet, but it's not an issue for many. So we have to recognize and acknowledge who it is an issue for, and what things are available for the tinnitus for that population.
Yeah, there are things available. There are things available, guys. And next question here is going to come from Diana. Put it on the screen. Diana on YouTube, hello Diana, asks, if hearing loss causes tinnitus, why doesn't the tinnitus lessen after getting hearing aids? Well, for a lot of people, it does lessen after getting hearing aids. Does the source of tinnitus change? Immediately, the perception is reduced for most people who use sound therapy or sound enrichment or hearing aids amplification. Long term, the brain can retrain and tune out the tinnitus so that it is not on our mind. We don't hear it as often. And eventually, when we do hear it, it's softer. That happens all the time. Online, on YouTube, on forums, you might not think that happens all the time, but in practice, that happens for a majority of cases. How do you want to add to this, Michelle? Anything to add here about if hearing loss causes tinnitus, then why doesn't the tinnitus lessen after getting hearing aids?
So I think that a lot of it has to do with our emotional response to the tinnitus. And so most of the time when you start to have an onset of tinnitus, you're not thinking, "Oh my gosh, what a nice sound," like as if it were bird chirping outside your window. So we automatically assume that maybe this is something, like I had mentioned earlier, something of danger, concern, worry. And so our emotional response to it almost breathes more life into it, and our brain then starts to attend more to it. And so I think that while sometimes the link between tinnitus and hearing loss is strong, the reason why tinnitus fades in the background for some and not for others has a lot to do with our emotional response to it. And so we can work on trying to retrain our emotional response to it so that way our brain also in turn attends less to it.
Excellent. Excellent. How are you guys enjoying this live question and answer? Let us know in the comments because I'm watching them. Next question here is about advice for sleeping. This is from Jude. All right. Jude asks, question, is there a device I can wear while sleeping to block out loud apartment neighbors? I have tinnitus, mild stage, and will it make my breathing louder in my head if I'm wearing something in my ears? So it seems like a question about earplugs or sound therapy. Thoughts, Michelle?
Yeah, so there's definitely a lot of different options that are out there for when we're trying to sleep at night and we want to use sound therapy. The fortunate thing is that there's a lot of different options, so we don't always have to have our ears plugged up. So I think that your question about will it make my breathing louder has a lot to do with what we call the occlusion effect. And that's the same thing that happens when we have headphones in our ears or we put our fingers in our ears where we start to hear our voice and our breathing and more of our physiological noises as louder and more boomy. And so there are options where you don't have to have your ears plugged up, and that way your ears are open to the environment, but yet you are having that sound blockage from the loud neighbors or your own tinnitus. So there's something called like a sound pillow, and that is literally a pillow that plays sound, and that way you won't have your ears blocked up. You can also just use, a bedside sound machine as well. So I'm assuming that probably hasn't worked too well for you thus far. That's why you're asking about something that you can wear. But I think if you're trying to avoid hearing your own breathing very loudly in your head, a sound pillow would probably be the best option because it will not have your ears plugged up, and you won't be hearing yourself as much.
Yeah, that's good. It's a give and take. It seems like that's a give and take. If you close your ear to block out your neighbors, then you will hear your own sounds inside your body. And I wanted to show this image here. So you were describing this occlusion effect, Michelle. Do you want to use this image to explain that a bit more?
Sure. So when we are plugging up our ear canals, then we're blocking the sound as it naturally passes through our ear canal to all the parts of our ears. So we have the outer ear, middle ear, and inner ear. And so the occlusion effect occurs when we start to block off the ear canal. And so because we're not allowing sound to naturally come in, and we don't have sound also being able to bounce back from our eardrum, then we start to feel and hear more of our internal sounds, and it sounds more hollow, more boomy. And so if we keep our ear canal open, then we'll be able to hear as we do on a normal basis, and our voice won't sound as hollow boomy, our breathing, our heartbeat. But once we kind of block that off at the level of the ear canal, then that's when we start to have that occlusion effect take place.
It's not fun, the occlusion effect. And this is something that comes up for those who need hearing devices or hearing aids. Plugging the ear, my own voice changes. There's a lot of nuances, a lot of intricate pieces of the hearing system. As an audiologist, I think we take that for granted. Let's check the next question here. I'm going to review the forms that were completed off of the link underneath the video. That's the formal way to request questions here. All right, so question here is, do hearing aids ever have a negative effect on tinnitus? I can take that one. Rarely do hearing aids have a negative effect on tinnitus. And if there's a minority of cases that have truly reactive tinnitus, and that means no matter what sound is presented, the tinnitus can get louder or react negatively to it. That's a very minor minority of cases we see. So there's a few reasons why hearing aids are worth trying, and there's safety mechanisms in place so that you can guarantee it won't make your hearing or your tinnitus worse. First of all, there's usually a 30 or 45-day trial period for hearing aids, so you're safe there with your financial investment. And the hearing aids, if they're programmed properly or FDA regulated, have safety mechanisms that they can't get too loud to the point that would damage your hearing, potentially spiking your tinnitus or something of the sort. So it's rare that hearing aids would make tinnitus worse, because 99% of times it makes tinnitus better. Michelle, from your experience working in person as an audiologist for many years, now working as a telehealth audiologist with our team, so grateful you're with us. What are your quick points on how to get the right kind of hearing aids for tinnitus?
So I think that it's important that you tackle tinnitus from two fronts. So obviously, managing if you have hearing loss, treating the hearing loss, because there are for some people just having more access to sounds, in turn helps them to hear less of their own internal tinnitus. So that's one way that hearing aids help. But you should also always get hearing aids that have sound generator, have like tinnitus therapy, built-in sound generators and tinnitus therapy within, because it allows you to kind of combat tinnitus both ways. So you'll be able to hear better, but you'll also have this background noise that you can activate. Either you can have it running all the time, or you can activate it at points in time when your tinnitus is more noticeable. And so you're not compromising hearing, because sometimes it can be, if you're using background noise and sound generators to help with your tinnitus, sometimes you might be listening to them so loudly that you're having difficulties hearing others around you. So having hearing aids that can do both is great. A lot of hearing aids nowadays have apps that you can use. And they have tinnitus sounds therapies within those apps. So you can choose and customize the sounds that are most relaxing for you and are better for helping you block out your tinnitus. So I think it's really important, if you get hearing aids and you have tinnitus, to make sure that they have those options available, because it may be part of the tool set that you need to in order to be able to manage your tinnitus on a regular basis.
And that's our main message here. Tinnitus can be managed, and it takes consistency, sometimes professional support, technology, tools of the self or psychology tools. And I also recommend a holistic touch in terms of sleep, stress, and overall wellness. So that's our main message, right? Tinnitus can be managed. We need to be
Absolutely.
screaming this, not too loudly, but screaming this from the rooftops, because the sea of information online is quite negative, and I don't think that accurately represents the population of individuals with tinnitus. I want to show a question here from Prep to Survive, who we've seen quite active in the YouTube comments on some other videos we produced. So thank you. prep to survive. I'm sure you're an EMT or some sort of a first responder, so it sounds like you have some medical experience. That's great. Question here: do either of you see any patients who experience ear pain, fullness, a cold feeling when they hear external sounds? So I'm hearing sounds, and my ear is either painful, full, or cold. I can answer that. Occasionally, I've seen other patients that have some ear pain or some fullness, but they go to the ENT doctor, and I advise you go to the ENT doctor to make sure that there's nothing physically wrong with the structure or abnormal to the structure of your hearing and your ears, the eardrums, the eustachian tubes, etc. Um, One thing that is sometimes frustrating is the reality that managing tinnitus and recovering from tinnitus and the habituation period is a bumpy road, and there's sometimes some uncomfortable feelings that come with it. Often there's uncomfortable feelings or sensations even that come with it. What can be very frustrating is, does this just happen to me, or is this something that's par for the course for tinnitus? Because, oh, if this happens to everyone and they get better too, then I'm not so anxious or worried about this. But if this is just happening to me, then maybe I'm missing something. And the mind tends to go to this place of, maybe I'm missing something. Maybe no one can solve my case because it's different. Maybe I'll never get better. Let's try to replace that with a realistic thought. Hopefully that's where we can help. In terms of the pain, fullness, you can occasionally feel that from eustachian tube, even if there's nothing wrong with the eardrums on a test like tympanometry. Do you have anything to add to this, Michelle?
I think it also brings up whether or not maybe you're experiencing hyperacusis, which is like elevated sound sensitivity at the same time as having tinnitus. And sometimes, an individual may have tinnitus as well as sound sensitivity. And we can actually have physical symptoms from that sound sensitivity. And it doesn't always have to be to, extremely loud sounds. You're saying, external non-harmful sounds. So I'm assuming, more normal level volume type of sounds. And it is possible that you may be also, like I said, experiencing hyperacusis alongside with the tinnitus. And I feel like, Dr. Ben has had a lot of experience treating patients that have had both or have had just the hyperacusis, the sound sensitivity, rather than the tinnitus. And so again, the takeaway is that there's definitely things with, using certain tools and management strategies, as well as with just time, things can get better in terms of hyperacusis as well as your tinnitus.
Excellent. Thank you. I'm a slight delay here as the commander here. Totally agree with everything you said. Well, this has been 30 minutes of the first Tinnitus Doctors Live, where we're experimenting with this live stream setting. Um, it's been fun. It's been fun. I would say it's been great from our end. And what we want to know in the chat is, do you want to see more of this? If you want to see more live stream like we're doing now, giving some advice, giving some tips, some techniques for managing tinnitus or hearing conditions, let us know in the comments, whether you're on Facebook or YouTube. Let us know, and I'll make sure to review those. And also check the description of this video, because you can get access to a form where you can ask your question. We didn't get to all of them today. The plan is to continue this on a consistent basis. So make sure you're subscribed to my YouTube channel, Ben Thompson AUD, where I'll update you guys on the schedule for this. I want to give a big, warm welcome from the tinnitus community to Dr. Michelle Neidleman Kennedy. Thank you for joining our team as a provider. And thank you for all the work that you've done over the years and with our team here for hearing and tinnitus. Do you have any last words for us?
No, I mean, I'm again just excited to be a part of the team, and I also think this has been very successful. So I hope that you guys join us again and we're able to get to more of your questions.
Amazing. All right, guys. Well, take care of yourselves, and we'll see you on the next live stream or the next YouTube channel episode. Bye bye.
Bye.